Hello again, Menopause Barbie here. If you're just joining us, we're in the middle of a discussion about the differences between alternative and complementary medicine and traditional medicine. In the book, we're on pages 97 to 99, and in the outline notes, we're in pages 20 to 22. Okay. In the last tutorial, we discussed the basic differences between these two camps. And today we're going to look behind the scenes to see what goes on before products hit the market in either of the camps. You see, it's insight into things that may not be so obvious to you that might make the difference in what you prefer for managing your menopause. Remember when I talked about the birth plan? You know, it's what pregnant women sometimes do before they go into labor. You know, they sit down and they write out exactly how they want their labor to progress, what they want or don't want for anesthesia, what positions they want, all that stuff, all these details. But the problem is they do this long before they go into labor when they're perfectly comfortable. And most of the time, they have never even experienced labor. You see, it's women who are having their first baby that do this the most. And even if they have had a baby before, they have no idea of knowing how it'll go the next time. So what happens when they go into labor is that they change their minds about almost everything. So menopause is like that. You know, you don't know what you'll want at various phases of your menopausal life. So the best thing you can do is learn everything you can, keep an open mind, and know that you can make your own decisions. Just know what's available to you and know some of these pieces of information about what's behind the scenes so that you can make good decisions. So, what's the difference between pharmaceutical drugs and dietary supplements in terms of the marketing? Why choose one or the other? Well, first let's look at how pharmaceutical drugs come to market. First, we're going to start with the definition of drug. A drug is a product used to diagnose, cure, mitigate, treat, or prevent disease. And drugs are regulated by the Food and Drug Administration, which you may recognize by the acronym FDA. And FDA approval requires 12 years, over $350 million per drug, and 3 separate phases of clinical trials for every drug. So pharmaceutical research costs $12.6 billion per year. Drugs are considered unsafe until they're proven to be safe. And drug manufacturers have to provide the FDA with evidence of safety and effectiveness before they can even market the drug. After they market the drug, the FDA follows up on all the adverse effects, and if there's a problem, they pull it from the market. So by simple FDA approval, quality and consistency are guaranteed for pharmaceutical drugs. So when you buy a pharmaceutical drug, what you'll have is information, packaging, so that tells you about the drug and about the approval process and all of the issues you need to know about it. So here's a pharmaceutical drug, and here's what's inside the package as far as information and labeling. I mean, look at this. It goes on and on and on. There is so much information here. I mean, everything you could possibly want to know. So that's what you get with a pharmaceutical drug. Well, what about these others? Here's another drug. Here is the labeling and package information here. Again, pretty extensive. There's a lot of information here. Let's see this one. Oh gosh, another book. Look how thick this is. Just reams and reams of information. So pretty much, oh, here's a birth control pill. And again, look, it's folded over and over and over again, and you just keep opening and opening. So lots and lots of information. Now, Let's go on to dietary supplements. A dietary supplement is a product that's intended to supplement the diet. So that includes your vitamins, your minerals, your herbs, your botanicals, your amino acids, all that stuff. Dietary supplements aren't foods and they aren't drugs. Dietary supplements are regulated by the manufacturer rather than by the FDA. An approval for a dietary supplement requires the manufacturer to follow what they call current good manufacturing practices. Claims about a supplement's function have to be followed by a very specific statement. They have to have on the package something that says, this statement has not been evaluated by the U.S. Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. So there's a difference in the two. You saw the package information for pharmaceutical products. Let's see what package information accompanies dietary supplements. Here's a very popular dietary supplement. It's called Remifemin. Here is the information inside. Okay, it's got some information, not a lot. Here's another one, Siberian ginseng. Here's the information, and okay, that's it. Here's evening primrose oil. Good stuff, good stuff. Let's see. Nothing. Okay, so no information. Everything's on the bottle or on the box. Let's look for that claim, the statement that says there's not been any evaluation by the FDA. Let's see where we can find that. Here it is. Siberian ginseng. This medicine has not been evaluated by the Medicines Control Council. This medicine is not intended to diagnose, treat, cure, or prevent any disease. There it is. Red clover. There it is. Small print. Got to look for it. Let's see. Remifemin. This says it's the natural, safe alternative to hormone replacement therapy for menopausal symptoms, but it has a little star, and then the star says this statement has not been evaluated by the Food and Drug Administration and is not intended to diagnose, treat, cure, or prevent any disease. So you see, there's a difference in what you get in the package labeling. When it comes to dietary supplements, manufacturers are not required to conduct clinical trials. See, these dietary supplements are considered safe until they're proven to be unsafe. And the dietary supplement manufacturer doesn't have to provide the FDA with evidence on safety and effectiveness before they market the drug. There's a regulatory body called the Dietary Supplement Health and Education Act. The acronym is DSHEA. And it can find the supplement unsafe, but only after it's already entered the market and caused harm. And once that happens, the FDA can step in and remove the product. So when it comes to the differences between these two things, don't equate the presence or absence of literature with safety. Don't think that the literature for a pharmaceutical product means danger and the absence of literature means safety. The opposite is really true. The literature that accompanies a pharmaceutical product is proof that it's been studied and approved. And the absence of literature accompanying a dietary supplement is proof that no studies have been conducted and it hasn't been approved. But, you know, which you prefer is still entirely up to you. What's important is that you understand the difference in how these things are approved, how they're marketed, and how they're regulated. You want to know this difference so that you can make a decision that you are happy with. So what about quality and consistency with dietary supplements? The quality and consistency for pharmaceutical products is guaranteed. What about with dietary supplements? Well, many of these products use different words. They use words like standardized, verified, or certified. So do those words mean the same thing as quality and consistency? No, they don't. The terms standardized, verified, and certified don't guarantee product quality or consistency. You see, an herbal product can contain dozens of compounds, or all its ingredients may not even be known. What's on the label may not be what's in the bottle. An herbal supplement may not actually contain the right plant species, or the quantity of the ingredient may be greater than or less than what the label actually says. It may even be contaminated with other herbs or with pesticides or toxic metals or germs. It might be adulterated with unlabeled ingredients. And sometimes there are ingredients that aren't actually labeled. They're called substitutions or fillers. You know, dietary supplements are herbal products, so they come from crops, they come from plants. And crops are sometimes mixed or substituted with less expensive or more readily available plants. And sometimes they accidentally get contaminated because one plant will grow in with another. I mean, this is just part of what happens in the plant world. So, is that a bad thing? Well, think about it. You eat foods that adhere to the same or to even lesser standards, and they don't harm you. So, are all of these regulations really necessary? You see, you get to provide the answer. Just because there's more information here and less here doesn't mean that one's good and one's bad. It's just a matter of understanding how they differ. You know, sometimes these labels have information, these products have information, but it's hard to read it because it's so tiny. So sometimes you kind of have to get out your magnifying glass. I mean, I look at some of these things. Here's vitamin C. But when I look at it, I'm so blind. With my magnifying glass, it says allergens. May contain traces of soy, cow's milk, peanuts, tree nuts, egg, wheat, or crustaceans. It's vitamin C. You know, you have to be careful. This is a herbal sleep medication, herbal sleep product, dietary supplement. And it has inactive ingredients. It has a whole bunch of inactive ingredients. Hypomellose, vegetarian capsule shell, microstalline cellulose, magnesium stearate, magnesium silicate, silicone, it goes on and on. There's a lot in here other than just the active ingredients. So know that these have things in them that aren't as well defined or studied as the pharmaceutical products. Let's see. Here you have MSM powder. This has MSM, which says it's the purest, most tested MSM ever. But it doesn't prove that. It just says that. So in any case, let me give you some safety recommendations for some of these dietary supplements. They're not bad, but you do need a little bit of guidance into using them properly. You shouldn't buy products that claim to work like prescription drugs. You shouldn't buy products that are advertised through mass emails. And you shouldn't buy products that are marketed in a foreign language. Uh-oh, guilty. I confess, I have bought products marketed in foreign languages and in foreign countries because I live in a different country every year, so I've probably used a lot of them, okay? I'm still here. And you shouldn't buy products that promise weight loss, bodybuilding, or enhancement of sexual performance. What you want to do is look for objective, research-based information so that you can validate, verify, evaluate a product's claims. Now, how do you do that? Well, some options are you can consult the manufacturer, you can talk to your doctor or pharmacist and see if they know anything, or you can check on any possible scientific research findings by calling the National Center for Complementary and Alternative Medicine or the Office of Dietary Supplements. And you know, one thing I definitely urge you to do is before you start trying a new herbal supplement, talk to your doctor, especially if you're taking other products, any drugs or any other herbal, alternative, botanical products, because these things can interact. And definitely tell your doctor if you're taking over-the-counter meds in addition to your prescription meds. Tell your doctor if you're about to have surgery. Tell your doctor if you're older than 65. Be sure you inform everyone in the medical community of all the products you're taking, both pharmaceutical and herbal and botanical. So some of the safety tips about using these are follow the instructions and keep track. What are you taking? Take one thing at a time. Keep a record of what happens when you take it. And be cautious about products that are manufactured in other countries. Yeah, I've taken them, but be cautious, okay? Know what that it says on the package. Be able to read the language well enough to know what it says. And check any alerts or advisories that you see. I made you a summary chart of the differences between pharmaceutical drugs and dietary supplements. The pharmaceutical drugs you can diagnose, cure, mitigate, treat, or prevent disease, whereas dietary supplements can't. Your pharmaceutical drugs are FDA regulated, whereas your dietary supplements aren't. Your approval of pharmaceutical drugs is strict and lengthy and expensive, whereas approval of dietary supplements only requires current good manufacturing practices. Pharmaceutical drug research is extensive and expensive, and dietary supplement research is pretty much non-existent. Pharmaceutical drugs have to prove their safety before marketing, and dietary supplements don't have to prove their safety until after marketing. And pharmaceutical drugs focus on safety, whereas dietary supplements focus on advertising. Finally, the quality and consistency of pharmaceutical drugs is guaranteed, whereas the quality and consistency of dietary supplements isn't. Now, remember, none of this makes one camp better than the other camp. You just have to match your goals with the products you're choosing to achieve them. Okay? So be realistic. Know what goes into the marketing of each of these products. And of course, nobody's opinion matters but your own in terms of what you choose. That's the most important thing. You know that I'm unbiased, and I'm not going to be persuading you to use one or the other, or lean toward one camp or the other, and I'm not going to tell you what to do. My goal is for you to know the facts about each of these camps so that you can succeed in whatever you choose to do. Okay, so that gives you a pretty good foundation for working within whichever category you find most suitable and preferable for managing your menopause your way. So I'll wrap it up here for today, and come back next time when we will discuss botanical and herbal therapy options and talk about nothing but botanicals and herbs. So I'll see you then. Bye.